Have you ever felt like your body is changing but you can't explain why? Maybe you're more tired than usual. Maybe your digestion isn't the same anymore. Maybe you've lost weight without trying. Or maybe you feel discomfort after meals that you simply blame on getting older. Many people over 60 ignore these changes because they seem small. They tell themselves it's just aging, it's probably my diet. Everyone feels this way eventually. But sometimes your body is not just getting older, it's trying to get your attention. Today we're going to talk about an organ that rarely gets discussed but plays a major role in digestion, energy, and blood sugar balance, the pancreas. Understanding the warning signs doesn't mean you should panic. It means you can recognize patterns, ask better questions, and have a more informed conversation with your healthcare provider. Welcome back. For many years I've worked with adults over 60, and one thing I've learned is this. The body often gives small signals before bigger problems appear. The challenge is that these signals are easy to misunderstand. Fatigue may be written off as age. Digestive problems may be blamed on a sensitive stomach. Discomfort after eating may be labeled indigestion. But when several changes appear together, they can sometimes point toward the same underlying system. Today we'll look at 7 signs that may suggest your pancreas is under stress and deserves attention. Most people know about the heart, the brain, and the kidneys, but the pancreas is an organ many rarely think about. It sits behind the stomach and performs 2 essential jobs. First, digestion. Every time you eat, the pancreas releases enzymes that help break down fats, proteins, and carbohydrates so your body can absorb and use nutrients. Second, blood sugar regulation. The pancreas produces hormones like insulin, which help cells use glucose for energy. When the pancreas isn't functioning properly, problems can appear in different ways because these 2 systems are connected. The digestive system may show changes. Your energy levels may change. Your blood sugar balance may become harder to maintain. The pancreas often doesn't announce problems with one obvious symptom. Instead, it may create a collection of small signals. Let's look at them carefully. One of the first things people may notice is a change in bowel movements. Not an occasional change after eating something unusual, but a pattern that continues for weeks or months. Signs that deserve attention include stool that looks unusually pale, stool that floats frequently, stool that appears oily or greasy, a stronger unpleasant smell than usual, or difficulty flushing. Why can this happen? Your pancreas produces enzymes that help digest fat. If your body isn't producing enough of these enzymes, some fat may pass through without being absorbed, affecting the appearance of your stool. Fat also helps your body absorb certain vitamins that support bones, immunity, vision, and overall health. When digestion is affected over time, consequences can develop slowly: dry skin, lower energy, weakness, and be mistaken for aging. If you've noticed persistent changes like these, mention them to your doctor. There is no reason for embarrassment. These details can provide important information. Another sign that should not be ignored is recurring discomfort in the upper abdomen. Some people describe it as a dull ache under the ribs, pressure in the upper stomach area, or discomfort that spreads toward the back. The timing can matter. Symptoms that appear after meals, especially after heavier or higher fat foods, deserve attention. Many immediately think it's acid reflux, and sometimes it is, but repeated discomfort that follows a consistent pattern needs a closer look. The digestive system is highly connected. The pancreas, gallbladder, stomach, and intestines all work together. Problems in one area can affect another. That's why details matter. Where exactly is the discomfort? When does it appear? What foods trigger it? Does it improve or keep coming back? These observations help your doctor understand what may be happening. The goal is not to assume the worst. The goal is to avoid ignoring something that deserves attention. Everyone feels tired sometimes. A bad night's sleep, stress, or a busy schedule can drain your energy. But there is a different kind of fatigue many adults over 60 describe. A feeling that your energy level has changed. You wake up tired. You feel exhausted even after resting. Simple activities that used to feel easy suddenly require more effort. Many accept this as normal, but persistent fatigue deserves attention, especially when it appears alongside other changes. One reason the pancreas may be involved is its role in helping your body use energy. It helps regulate blood sugar through hormones like insulin. When blood sugar regulation becomes unstable, your cells may not receive energy properly, contributing to tiredness, weakness, and difficulty concentrating. Another reason is digestion. If your body is not absorbing nutrients properly, you may eat enough but not get the benefits. Fatigue combined with digestive changes, unexplained weight loss, or other unusual symptoms is something to discuss with a healthcare professional. Weight loss is often celebrated when intentional, but losing weight without changing diet or exercise is different. Especially after 60, unexplained weight loss should not be ignored. People may notice clothes becoming looser, losing muscle strength, a smaller appetite, or eating less without realizing it. Digestive problems can make the body less efficient at absorbing nutrients. Discomfort after eating can cause people to avoid certain foods and unknowingly reduce calorie intake. Over time, this can lead to a gradual decline in weight and muscle. Ask yourself, did your body change, or did you intentionally change habits? If your weight is dropping without a clear reason, bring it up with your doctor. Small changes are easier to understand when noticed early. Another signal is a change in appetite. Food may not feel as enjoyable. You may feel full quickly, uncomfortable after meals, or experience recurring nausea. Many think their stomach is just becoming more sensitive. But persistent appetite changes can have many causes and deserve evaluation. The pancreas plays an important role in digestion. When digestion becomes difficult, eating can trigger discomfort and the body may begin associating meals with unpleasant feelings, gradually reducing appetite. A temporary change is common, but a lasting change, especially with weight loss, fatigue, or digestive symptoms, should be discussed. The pancreas is also central to blood sugar control. It produces insulin, which helps move sugar from your bloodstream into your cells for energy. When this process is disrupted, signs can include increased thirst, more frequent urination, blurry vision, feeling shaky or weak when meals are delayed, or unusual changes in blood sugar readings. Many think of blood sugar problems only as type 2 diabetes, and type 2 is very common. But changes in the pancreas can also influence blood sugar regulation. New blood sugar changes, especially later in life, deserve proper medical evaluation. It's not about assuming a serious diagnosis, it's about understanding why the change happened. The most important point is this. One symptom alone does not automatically mean there is a pancreatic problem. Fatigue, digestive changes, and abdominal discomfort can come from many causes. The key is the pattern. The body often communicates through combinations: digestive changes plus unexplained weight loss, or fatigue plus appetite changes, or abdominal discomfort plus new blood sugar changes. When several things appear together, it becomes more important to look deeper. Your symptoms are not separate messages. Sometimes they are different parts of the same story. What should you do if you notice these changes? The first step is simple. Pay attention. Write down what you notice. Ask, when did this begin? Has it become more frequent? Does anything make it better or worse? Are several changes happening at the same time? This information is valuable when you speak with your doctor. A healthcare provider may check blood tests, digestive function, blood sugar levels, or imaging depending on your symptoms. The goal is not fear. The goal is clarity. Many conditions become easier to manage when recognized earlier. The pancreas is a small organ with a very important role. It helps your body digest food, regulate energy, and maintain blood sugar balance. Because it works quietly in the background, its warning signals can be easy to overlook. A change in digestion, new fatigue, unexplained weight loss, discomfort after meals, or appetite changes. These are not things to panic about, but they are things worth listening to. Your body is constantly giving you information. The question is whether we slow down enough to notice it. If something about your health has changed and you cannot explain why, don't simply accept it as just getting older. Bring those observations to your healthcare provider. A simple conversation can be the first step toward understanding what your body is trying to tell you. Thank you for watching. Take care of yourself and remember, your health is built through awareness, attention, and the small choices you make every day.